Garo Hills is situated in the northeastern part of India. It belongs to the state of Meghalaya, which translates the abode of the clouds. The state is known for recording the highest rainfall in the world. The Garo Hills is predominantly inhabited by the Garo tribe. The famous song, I Have Decided to Follow Jesus, was written after the story of a Garo man who was martyred for his faith in Jesus Christ. One of the major challenges in Garo Hills is poor health care due to poverty, heavy rainfall, and bad roads, and the lack of trained medical personnel willing to serve in the rural parts of Garo Hills. The healthcare has been a major challenge. For many years, Garo Hills was affected by underground terrorism, which hampered the development of the region. Malaria was a major killer, and many people died each year because of it. Garo Hills has one of the poorest health indicators in the country. Looking at the need, the Seventh-day Adventist Church initiated to start a small mission hospital that will be able to help the community meet the medical needs. In 2018, a young medical missionary couple, Dr. Daniel and Dr. Dorothy Joshua, were called to start the medical missionary work in Garo Hills. With limited facilities and resources but abundant in faith, the medical work began in 2018. The work started in a small little village which is strategically located. Having no building to start with, the church leaders found a small 2-story building that was left abandoned for 5 years. The building was owned by an ex-underground terrorist who was kind enough to give it for rent. The facility was converted into a 10-bedded medical mission hospital. The Lord brought in workers, and on May 26, 2018, the rental facility was inaugurated for the glory of God by the government minister James Sangma. The Lord blessed the little mission hospital beyond measure. There were many stories of miraculous healing. The Lord brought in a committed team. There was a desperate need for an obstetrician and a gynecologist, but who would respond to come to a little mission hospital? In 2019, the Lord touched the doctor couple, Dr. Paul and Dr. Susie, to join the hospital. Dr. Susie, a gynecologist, and Dr. Paul, a pediatrician, having worked for the WHO for many years. The hospital began expanding. The Lord brought in committed Adventist doctors, Dr. Pranay and Dr. Hamadon, to join the medical team. The Lord brought Dr. Bona Das, an Adventist anesthesia resident, to join the hospital team to assist in surgeries and also the ICU care. One of the most striking stories of the Seventh-day Adventist Mission Hospital is the story of Simikchi, a 12-year-old girl from a village called Mangre, left to die because of a severe skin infection called necrotizing fasciitis. She was brought to the clinic where she was treated. God heard our prayers. Simikchi was miraculously healed over time. Today Simikchi is healthy and back to school. She's a 6th grade student studying at Riverside Academy, and she is a first-rank student. God used her to bring many people to the foot of the cross. Many people from the village accepted the Adventist faith after the story of her healing. There was a desperate need for expansion, but due to lack of financial resources, this was not possible. The 10-bedded mission hospital often admitted over 20 patients. Is there anything hard for the Lord? A newly constructed government hospital situated just 1 kilometer from the present location was left unused for over 5 years. The Lord touched the hearts of the government leaders to see the blessing the little mission hospital has been. The government leaders requested if the Seventh-day Adventist Church would come and take over the newly constructed facility and operate it on a public-private partnership mode. The hospital would be a referral hospital, and the government was even willing to support the church by providing a grant in aid for the operations. This was an answer to prayer. The Lord opened an incredible door for the church to reach to the people of Garo Hills and beyond. In December 16, 2021, the new hospital was inaugurated and handed over to the Seventh-day Adventist Church. This is one of the first of its kind in the country of India, where the government hands over a secondary level referral care hospital to any private organizations. The new hospital campus is a 30-acre property which houses all the medical staff. The Lord has blessed His work which He had started. The new hospital is a 34-bedded multi-specialty referral center as well as a training center for government medical doctors for Garo Hills and beyond. It has been 2 months since the work began in the newly God-given healthcare facility, and God has been blessing the medical missionary work in Garo Hills in a very powerful way. Mahima, a 10-year-old girl from Shillong, about 8 hours from Jinjal Hospital, was brought to us after she developed severe infection following a burn. She has been in the hospital for over a month, and we can see how the Lord has been blessing and healing her. Miracles like this are seen every day in the hospital. The Little Mission Hospital has now evolved to become a major referral hospital in the Garo Hills region. Each day there are numerous patients that visit the hospital seeking good quality medical care. The hospital is able to provide good medical care in different specialties. Each day, patients from different parts of Garo Hills come here seeking medical care. The hospital has also been involved in training doctors from different districts. Each day, emergencies are referred to the hospital. Aja Manisha, a 5-year-old girl, was brought to us when a tree fell on her head. She was unconscious to a point of death. God did a miracle. After neurosurgery, she is better and ready to go home. Miracles like this happen each day in this hospital, and we can see how God has used the subdivisional hospital operated by the Seventh-day Adventist Church to be a blessing to the community. God is the center of healing in the hospital. Each day the work begins with a special season of prayer. The hospital stands as a testimony of what faith can do.